So in today's video, I want to go through 10 tips that you can do if you have a disc bulge that may or may not be compressing or irritating the nerve and referring some pain or sciatic type symptoms down into your leg. And by following these 10 tips, hopefully you'll find that your symptoms will settle down just that little bit faster, allowing you to get back to the things that you need to do more quickly. So the first tip is potentially one of the most important, and that is if you have a disc bulge or a disc-related back pain, it's really important that you listen to your body. Anything that's very closely associated with your nervous system will have your body telling you in no uncertain terms what it does appreciate and what it doesn't appreciate. And in terms of what it doesn't appreciate, that can be a lot of different things depending on you and your specific symptoms, but it can not only relate to the things that you do, but how long you do them for and how often you do them throughout the day. So by listening to what your body has to tell you in these moments, you'll very quickly understand what might be too much or too little for your body at any point throughout the course of your rehab from a disc bulge. The second tip is to avoid any unnecessary sitting. The reason for this is that the discs that sit in between each vertebral segment of your spine are loaded up more in sitting related positions, especially if the quality of those shapes are a little bit more rounded than they could be. Sitting and flex based positions tend to increase the amount of pressure that goes through the disc itself, and considering that most disc bulges are posterior or backwards facing bulges, when we tend to sit and potentially lean forwards a little bit, tends to create a pressure that compresses the front of the disc, increases the force that goes out towards the back of the disc, and can irritate and annoy the symptoms that you may currently have. So you may already know this as someone who is experiencing lower back pain at the moment from your disc-specific tissue. So again, if you're listening to your body, you'll know exactly how much tolerance you may have for sitting, whether it be a couple of minutes or half an hour. But if you have the opportunity to avoid sitting or at least get up more often, please take that opportunity as often as you can. Because the more time you may spend sitting, the more you might be loading up that disc in a way that perpetuates that irritation and that soreness, making it harder for that tissue to settle down quickly. And following on from tip number 2, the third tip is very similar in that we want you to avoid any unnecessary bending. From a similar perspective to sitting, where sitting can cause more of a flexed based position for that spine, creating more pressure through the back of the disc, feeding into that potential bulge or that potential irritated tissue at the back and potentially irritating some of the neural tissue that passes just through that same area. The same thing applies mechanically when you're standing, leaning forwards. Now, if you can find a way to bend down and lean forwards by using your hips more than keeping your hips still and bending through your back, then in theory it may feel more comfortable. But when we're trying to do anything and everything that we can to resolve your symptoms and get you out of that irritated stage as quickly as possible, if you know that bending is something that can potentially irritate your back over time, then it goes without saying that it's best to try and avoid that as best as you can. And again, similar to sitting, there may be so many opportunities that you can't avoid while you have a disc bulge, but if you do have some control over the positions and the movements that you do with your back, make sure that bending forwards is one of those that you try and preserve as much as possible. So tip number 4 revolves around finding your spine and your symptoms directional preference. And what a directional preference is that we understand that certain types of back complaints, whether it's a disc bulge or a stenosis or a nerve irritation, have a directional preference that they like to move in that resolves and settles down your symptoms. Conversely to that, there may also be a direction that irritates and annoys those symptoms as well. So with most disc bulges, we know that flexed based positions that might increase the pressure on that disc and potentially the pressure at the back of that disc facilitating that bulge may have a directional preference away from a flex based position, which may include sitting or bending forwards. For most disc related issues, you may have a directional preference that involves extending through your spine or arching backwards. The idea behind this is again the opposite to what happens when you flex your spine. When you extend your spine, the back of the disc closes down. The idea being that if we do enough of those extension based movements, we can try and recenter the disc back into the middle of where it should be, ultimately trying to resolve those symptoms in a fast amount of time. And 2 very simple extension based movements that you can try are lying down flat on your belly, squeezing your bottom, gently extending back as far as you feel comfortable, and coming back down again. You can stay at the end of your range if it feels comfortable to you, but ultimately start by doing some gentle, active extension-based motions, see how it feels, and progress it from there. Similarly, you can do the same thing in standing, again, squeezing your bottom to put your pelvis in a good position, gently arch backwards as far as you feel comfortable, paying close attention to what your symptoms are doing, especially any leg or referred pain that might be going down into that area. Do your 10 to 15 repetitions if you feel comfortable doing them. Reassess your symptoms before continuing further. So following on from extension-based movements, the fifth tip revolves around making sure that you keep your body moving. Walking is something that can be beneficial for any type of low back pain, especially disc dysfunction. Most of the tissue in our spine enjoys the micro movements that are associated with something as simple as walking. So it's really important that in the process of trying to protect your back and allow those symptoms to settle, that you're not just divorcing yourself from all movement altogether. But again, coming all the way back to that most important tip number one, we've got to make sure that we're doing it at a level that feels respectful and comfortable for you by listening to your body. So if you are in extraordinary amounts of pain and you find that you can only walk for 5 minutes before your tissue becomes too sore and uncomfortable, then again, try and get ahead of that and make sure that you're just walking around for 2 or 3 minutes and then pausing and having a break to manage those symptoms as best as you can. It's not worthwhile for you to push through the pain, especially disc-related pain, just to tick the box of walking because someone has asked you to do that. And when dealing with the aggravated tissue associated with a disc bulge, it's important that you have a strategy to try and settle down that irritation as quickly as possible so that you can get back to what you need to do. We can turn to something as simple as deep breathing to try and calm that tissue back down again. And the reason why deep breathing can potentially be so effective with this type of issue is that most pain is associated not just with tissue damage or tissue injury, but with a nervous system that becomes heightened and threatened. Pain is just an expression of your brain and nervous system's perception of threat, of which a disc bulge or a nerve root compression certainly falls within that umbrella. But it's really important to understand that the pain that you're experiencing is a consequence of how threatened your brain and nervous system feels. By thinking of the irritation and the soreness that you're experiencing as your brain and nervous system's perception of threat, anything that we can do to down-regulate or de-aggravate or de-escalate that heightened nervous system can go a long way to helping your pain settle. And what I like to tell my patients clinically is something as simple as a full breath in, like with a slight pause at the top, closely followed by a sigh on the way out, can really allow your brain and nervous system to be prompted to feel safer. And if you have the time and the space to consistently deep breathe throughout the day, consistently tell your nervous system to de-escalate and down-regulate, then you might find you can get through this initial irritated and aggravated stage faster than what you would be if you just relied on pain medication and other things. And when discussing pain medication, tip number 7 revolves around the need to responsibly take your pain medication when needed. In physiotherapy, it's always best to avoid taking pain medication if you can tolerate it. The idea being that pain is a very useful piece of information that helps us understand exactly what our limits might be with anything and everything that you might do day to day. Your ability to understand how far you can walk, how much sitting you can tolerate, how much bending you can tolerate, with your directional preference, extension-based exercises could be helpful or hindering you. All of these things require some sort of pain signaling to let us know where our boundaries are. And if we're going to try and get you through this as quickly as humanly possible, we do need to know what your current limits are, what your current tolerance might be, and respectfully work within that as best as we can. But having said that, any mature adult conversation around the use of pain medication needs to respect the fact that you have a life, you have things that you need to do. So if you find that your pain is genuinely getting in the way of you completing the tasks that you have to do during the day, then it's reasonable to try and look at some form of pain medication to help you tolerate the things that you have to do. Similarly, if you find that your pain is interrupting the quality and the duration of your sleep, I would strongly consider taking some pain medication because sleep is a very important part of healing. If you don't get enough sleep, it's hard for your body and your tissues to calm down. It's hard for that healing process to take place as effectively as it could be if you're getting a full night of quality sleep. So while pain medication needs to be used responsibly throughout the day and over the night, it's up to you to make sure that you make a responsible decision as to how much pain medication you might actually need to take and whether that pain medication is actually helping you or hindering you long term. And on the topic of rest, tip number 8 revolves around resting as needed. So if you find that you have a choice between sitting and lying down, please choose lying down because again, the forces that go through your back when lying down are less than if you are up against gravity in a standing or a sitting based position. But we don't want you to commit to resting for the entire day. We want to make sure that during those periods of rest, you then supplement that time with those walks at the level that you feel comfortable with, making sure that you're moving around, changing positions as much as you feel you can tolerate to again make make sure that the disc is loaded respectfully, but not too much. Once again, if you are listening to your body, you will know how much lying down you need to do to get through the day and to balance out your disc loading enough for those symptoms to settle. But we don't want to promote rest as the one thing that you need to do. We want to use it as a piece of the puzzle that can help you manage this as best as you can to get it to settle down as quickly as possible. And tip number 9 is that it's really important that you find a way to stretch your hip flexors. The reason why hip flexor stretches are potentially really important for disc issues and a lot of lower back pain in general is that our hip flexors anchor to the front of that spine. Those hip flexors attach from the front of your thigh into the front of your lower back. And if for whatever reason those hip flexors are extra tight, again, it's another strategy that we can employ to decrease the amount of load that your spine undergoes day to day, feed some more slack back into those discs, take some of the tension out of that structure, and hopefully help that tissue feel less irritated, your nervous system feel less threatened, and allow that whole process to go away as quickly as possible. And again, if you've been a fan of the channel, you'll know that one of the best exercises I find to stretch hip flexors is the kneeling hip flexor stretch. What you want to make sure that you do is if you can get down to the floor, you are welcome to. You can do the same stretch off the side of a chair if it's comfortable for you and your back. We want to make sure that we take that knee behind you. We want to push our hips forwards, opening up the front of that thigh, the front of that hip as best as possible. Wherever you feel that tightness, we want to make sure that we tense that tightness to make that tissue work. That includes squeezing your bottom, squeezing the tissue at the front of your hips at the same time for 5 to 10 seconds. When you stop tensing that tissue, it prompts that tissue to release immediately. And if tightness through your hip flexors is contributing some way to your lower back pain, then releasing that tissue may help that pain settle down that little bit faster. And the final tip that I wanted to go through in regards to any disc-related bulge is that we definitely want to respect what a scan shows, but we can't let it define how you feel or what we get you to do long term. For years, we used to assume that whatever came up on a scan, whether that be an X-ray, a CT scan, or an MRI, would solely describe exactly why you have your symptoms. But we can't just assume that whatever the scan shows dictates how you need to feel about your back and how your back's going to look going forwards. Ultimately, we need to consider it one piece of a broader puzzle if we are to truly understand what you need to do to get better. Things like joint stiffness, muscle tightness, postural habits, how heightened your nervous system might be do not show up on a scan, but they can absolutely contribute to the severity and the location and the duration of your pain. So just because your scan may show something, it's really important to not let that dictate how you feel about your back now and long term. And when dealing with your scan results, it's really important you have someone look over your scans and you as a person physically to marry up what's important to take from that scan and what isn't important long term. So ultimately, I genuinely hope any one of those 10 tips, if not all of those 10 tips, help you resolve and get through your disc-related back pain as quickly as possible. But with that being said, thanks for watching, and I'll see you next time.